On the last installment of Advancements in Healthcare, we learned about a martial arts practitioner who was sidelined by shoulder pain and lack of motion and sought help from Dr. Anthony Romeo. Today, we'll learn what steps Dr. Romeo and Paul will take to treat his osteoarthritis and bone spurs.
We see that bone spur has gotten large enough that when you rotate that arm, it's going to bump right into the edge of your socket. I explained to him, Paul, there's a few options for you. One is we can treat this without surgery with some medications and some physical therapy. Well, Paul had already been through all of those things, and that was no longer being successful for him. The second option is we see, is this a problem that we might be able to help out with a simpler operation like an arthroscopic procedure? Unfortunately, he had already progressed beyond the point where that would have been a predictable surgery. So then the final option is a shoulder replacement. The bone spur now has basically grown beyond the boundaries of the socket, so every time you move, it's just going to bump on the edges.
Right.
There's nothing we can do about that except take it out.
Take it out. Dr. Romeo was really good at explaining, here's what I would recommend, and it's obviously the ball's in your court.
After a discussion with Paul, we agreed that he was the appropriate candidate for a shoulder replacement.
Every year, 53,000 shoulder replacements provide dramatic benefits for those with joint pain.
Total shoulder replacement for osteoarthritis is a very successful procedure. It eliminates the pain in more than 90% of the patients to where they don't have to take any medications anymore. The range of motion is also improved, in many cases 20, 30, 40 degrees more than they were able to do prior to their surgery. They can now train up their muscles and gain more strength and return back to many activities. So that was something that was very attractive to Paul, and he was very interested in proceeding with the operation.
The team at Romeo Orthopedics quickly started planning for surgery. The next step was to get a CT scan for detailed information about the injured area.
We do go over some things to try to make sure that everything goes very smoothly. First of all, we schedule them for a computerized tomography scan. This CT scan will give us high resolution and definition of their shoulder joint, particularly the humeral bone and the scapular bone.
Advancements in technology, such as the use of CT scans, have enabled shoulder surgeries like Paul's to be performed on an outpatient basis with many benefits.
Total shoulder arthroplasty is a very reliable and safe procedure, and now it's the same in an outpatient environment, which makes it even more comfortable for our patients. In the outpatient environment, if the overall procedure and value is the same as in the hospital, but the cost is less, the stress is less, then overall this is a better value for our patients.
When talking with Dr. Romeo, he was very reassuring in looking at what was needing to be done and what would be the best timeline to try and get that taken care of.
Next week, we'll follow our patient and team on Surgery Day and learn how advancements in technology are making shoulder surgery safer, more efficient, and more convenient for patients.
Hi, I'm Dr. Anthony Romeo. If you're having shoulder and elbow problems and would like to know what treatment options are available, I'd love for you to call us or contact us on our website at romeoorthopedics.com.